right. Good morning, good afternoon, and good evening, everyone. Thank you for being with us today and for joining this launch event for the Knowledge Management Roadmap for Public Health Emergencies. If you are just joining, please introduce yourself in the chat. We would love to know your name, your organization, where you're based, and also what public health emergency you've worked in if you have. So thank you to those who have already introduced yourself in the chat. It's nice to be with you all today. Before we begin, please note that French interpretation is available for this webinar. We ask that you all please select your preferred language as either French or English, and you can do that by clicking on the globe icon at the bottom of your screen where it says interpretation, and then select English or French. And because we are providing live interpretation, we're also asking that all of our speakers speak a little slowly, and I'll have to remind myself of that. And we're also pausing before we transition from each side to give our interpreters a chance to catch up. So today I am very happy to introduce our speakers for this session. Today we'll hear from Alexia Bishop, who is the Senior Knowledge Management and Organizational Learning Advisor at USAID Washington. We'll also hear from Natalie Apgar, who's a Program Officer 2 with the Knowledge Success Project. And Natalie was also one of the authors of the KM Roadmap for Public Health Emergencies. Then we'll hear from Yvonne Wangale, who is a consultant with Knowledge Success and also a lecturer at Daystar University in Kenya. And finally, I'll be speaking as well. I'm Anne Ballard-Sarah. I'm the partnerships team lead at Knowledge Success and also one of the co-authors of the roadmap. So today we'll start with some opening remarks from Alexia at USAID regarding the importance of knowledge management in an emergency. Natalie will then provide a brief overview of the KM roadmap for public health emergencies and the associated tools such as the training slide deck, video, and the templates that are available for use. We'll then hear about 2 case studies on how knowledge management was integrated into 2 different public health emergencies. So first, Yvonne will share several examples of how knowledge management tools and techniques were used in the USAID-funded COVID-19 response by the Knowledge Success Project. And then I'll do a deep dive into how knowledge management was used to strengthen the USAID-funded Zika response efforts under the previous Knowledge for Health project, or K for Health. And then finally, we'll have time for what I hope will be a very rich discussion with all of you. Throughout the session, please write any questions that you have for any of the speakers in the chat, and we'll be sure to address them at the end. And just a reminder that this session is 1 hour and 15 minutes long, and we will be sharing the slides and the recording with you all afterwards via email. So with that, I will hand it over to our first speaker, Alexia Bishop. So Alexia, over to you.
Thank you, Anne, and welcome again, everyone, and thank you for joining. Okay, so today I'm very excited to be a part of the launch of this new tool called the Knowledge Management Roadmap for Public Health Emergencies. It was developed by Knowledge Success with support from USAID, and we are very pleased to have partnered with the Knowledge Success Project on this activity. They adapted and integrated content from several foundational knowledge management resources and other literature to create a resource really tailored to the use of knowledge management in emergency contexts. So we'll get more into the tool in a moment, but I first wanted to begin by ensuring that we are all starting from the same baseline in terms of our understanding of knowledge management. Next slide. So at USAID, we've been working in knowledge management for a long time, but it's more recently becoming even more formalized, including a forthcoming agency knowledge management and organizational learning policy, which we're very, very much looking forward to having available soon. There are, of course, many different definitions of knowledge management. Under this new policy, USAID defines knowledge management, or KM, as the process of generating, curating, organizing, sharing, and using knowledge to create value or support decision-making in context. It's about connecting people, processes, and technology, helping to ensure that the right information gets to the right people at the right time. By strengthening knowledge management, we can help to ensure that knowledge informs work at USAID, among our implementing partners, and with host governments, so that we can continuously advance our contribution to development and humanitarian efforts. Strong knowledge management contributes to building and nurturing a culture founded on evidence, lived experience, local and indigenous knowledge, and wisdom. So in the context of an emergency response, knowledge management is critical for creating a culture of adaptation and constant improvement and learning. In these moments, information can change quickly, often leading to information overload that hinders decision-making. In these moments, it is even more essential that governments, donors, implementing partners, and health professionals have access to timely and accurate information. So whether or not you've worked in an emergency response, after living through the last few years, and in particular at the beginning of the COVID pandemic, you can probably relate to the almost constant evolution and bombardment of information that we all experienced, often with changing or even conflicting information. For health professionals working in these emergency settings, where speed is of the utmost importance, knowledge management tools and techniques can strengthen collaboration and knowledge exchange, avoid duplication of efforts, and ensure that the latest evidence is put into practice. With knowledge management tools, partners can quickly share both formal and informal learning regarding what's working and what's not working, being able to adapt and pivot as an emergency evolves. So what exactly is the KM roadmap? While the roadmap was developed as a result of the COVID response, the knowledge management roadmap for public health emergencies is very intentionally not intended as a KM roadmap for COVID, but rather it's intended to strengthen the capacity of donors, governments, implementers, and organizations to implement knowledge management activities in any public health emergency response. Given the fast-paced nature of many emergency situations, the roadmap was designed to help fill a need for systematic ways of ensuring professionals have the right information at the right time. The tool outlines a step-by-step process for how knowledge management tools and techniques can be implemented during a public health emergency to strengthen the overall response, and it is meant to supplement global and national guidelines for public health emergencies. It provides customizable templates that implementing partners, public health professionals, and donors can easily modify to fit their needs. And it also includes equity considerations for knowledge management interventions during health emergencies. Next slide. So who is this guide for? This guide can be used as a resource for public health professionals, including across relevant USAID bureaus and offices, and among implementing partners and health workers. It is meant to be used before, during, and after a public health emergency, though it could also be used at any stage of a response. Many sectors, including health, are often implicated in a humanitarian or emergency response, which you can see depicted in this figure to the right. This figure outlines the humanitarian coordination and cluster approach by Humanitarian and Emergency Relief Coordination and was developed by UNHCR. In the roadmap, this cluster approach is used to depict a set of structures, processes, principles, and commitments to coordinate humanitarian action when a national government requests international support. It recognizes that the response to such health emergencies cannot occur in a silo. For example, even though the COVID pandemic was a public health emergency, it also affected other sectors, such as the education sector, with many schools temporarily closing, or supply chains with certain items impacted, either delayed or with price increases. So given the variety of impact, it's important for health professionals to be aware of any broader implications during any emergency response. In the development of this resource, Knowledge Success worked very closely with USAID to provide details on how the different roles or actors in an emergency response could play out during an emergency. Specifically, this guide is meant to be used by 4 primary actors, including governments leading overall public health emergency response efforts, international, national, regional, or local donors, the knowledge management lead, which would be identified and funded by a donor or government, and implementing partners made up of public health professionals. When an emergency happens at the global level, we would generally expect an international donor to collaborate with governments to identify and fund a knowledge management lead organization as a part of an emergency response. Or in the context of a country level emergency, we'd likely expect to see national, regional, or local donors allocate funds for the emergency response and a knowledge management lead organization identified in collaboration with the relevant government and donors. So whether a part of a global or country-specific emergency, it's important for public health professionals to have access to timely and accurate information. Incorporating knowledge management tools and techniques into an emergency response plays a critical role in setting up the response and the health systems that it supports for success. So with that, I will now turn it back over to Anne for the next part. Thanks.
Thank you, Alexia. Thanks for a great introduction and presentation. Please include any questions that you have for Alexia in the chat, and we'll be sure to address them later. Next, I am happy to invite my colleague Natalie Apgar to formally launch the Knowledge Management Roadmap for Public Health Emergencies. So Natalie will be providing us with an overview of the roadmap and the accompanying materials. So Natalie, over to you.
Yes, thank you, Anne. Good morning, everyone. I'm going to just give a moment for the interpretation to get up to speed. But thank you. Thank you for joining us. I'm very excited to be officially launching with this webinar, the KM Roadmap for Public Health Emergencies. So let's go ahead and share the link to the training module again in the chat to make sure that participants have it. And before I begin with the overview of the KM roadmap, let me explain how this resource package was developed and how it is affiliated with the Knowledge Success Project. The KM roadmap and accompanying materials are part of a training module on the Knowledge Management Training Package, or KM training package. This is an online training resource with numerous ready-to-use training modules for KM trainers and health program managers, managed by Knowledge Success and funded by USAID. If you want to learn more about a KM subtopic for global health programs, head over to this website and check out the various training modules, including the Building Better Programs Guide, which is our foundational guide for KM implementation in global health, from which this KM roadmap for public health emergencies was adapted. The slides in my presentation are part of the training module, which is available for free on the website. This training module, you'll find the full guide, the full KM roadmap, a shortened, condensed version, which is intended for quick reference during implementation, or we call it a pocket guide, customizable implementation templates, slides for trainers, and an animated video version of the roadmap. All of these materials are available in English, French, Portuguese, and Swahili, which is really exciting. So as Alexia shared, the KM roadmap for public health emergencies outlines a step-by-step process for how KM tools and techniques can be implemented during a public health emergency to strengthen the overall response. Let's take a look. So before we dive in, I want to briefly touch on the importance of considering equity in KM interventions, which is something our project has strived to do and has worked to publish tools to support. And this is no different during public health emergencies. In fact, equity imbalances are often accentuated during emergencies. Therefore, we included equity considerations for KM interventions in these contexts in the module. With this lens, we understand that in global health emergencies, unfair, avoidable, and remediable differences in health status are accentuated through limited knowledge creation, lack of access, and sparse or restricted use among groups of public health professionals. Power and privilege imbalances are amplified as the divisions between who has power and who does not widen. To learn more about equity in KM, refer to the complete equity checklist, which is shown here and will be now shared in the chat. The equity checklist and how-to guide is a tool that Knowledge Success developed to help global health program teams raise awareness, uncover equity imbalances, potential inequities in their knowledge management programming, and identify where to focus efforts to address them. So as I said, we've added equity tips and considerations in each step of the roadmap. In the interest of time today, I won't go over these equity considerations, but know that you can find them in the So next slide, please. Thank you. With that, let's get into the 6 steps for generating, collecting, analyzing, synthesizing, and sharing knowledge during a global health emergency. You'll see the roadmap icon illustration on the screen, which outlines the 6 steps. These steps are enabling environment, rapid and routine assessment of needs, design the KM strategy, create and iterate, then mobilize and monitor, and finally evaluate and evolve. Let's take a look at step 1. Step 1 is the enabling environment. To create this enabling environment, first ensure that the KM activities have funding and are prioritized at the beginning of the emergency response. Next, the stakeholders develop a scope of work for the KM interventions, and the donor identifies an organization that can lead them. This KM lead, as Alexia mentioned in the table that she shared, should understand and be connected to the relevant public health professionals and will ensure that KM is strategic and systematic throughout the emergency. It's important in this step to establish the KM lead and their roles and responsibilities and ensure that partners know how to connect with the KM lead for collaboration. Set clear expectations about how others will contribute to the KM initiatives. Step 2, rapid and routine assessment of needs. Whenever we design KM interventions, we want to understand the needs of the stakeholder audience we are trying to reach. So first, define the stakeholders of your needs assessment. Be specific. Conduct your needs assessment among the public health professionals responding to the emergency. Select individuals that need timely and reliable information quickly to inform their programs. This step should include conducting a rapid landscape assessment of all the implementing partners, their roles, and where they are working. You can find a template for this in the module. Then decide what key questions you want the needs assessment to answer. So common questions center around the types of information this audience group needs, how they prefer to access information, their capacity strengthening needs, and facilitators and barriers to accessing, sharing, and using information. You can also find a template for this in the module. Next, select and implement the appropriate methods to answer your questions. In an emergency, choosing methods that will provide rapid results and minimize the time commitment from implementing partners is key. This could include conducting a desk review or surveying members of a community of practice, for example. Then analyze and use the information gathered to adjust your learning objectives as needed. And it's important to note that the needs should be assessed frequently given the rapidly changing environment in an emergency. As new information arises or as the emergency progresses, stakeholders will develop different needs. Step 3 is design the KM strategy. To do this, first decide on KM objectives from the results of the needs assessment, ensuring that they are SMART objectives, specific, measurable, actionable, realistic, and time-bound. An example of a SMART KM objective is, for example, strengthen knowledge exchange among USAID-funded COVID-19 implementing partners through at least one virtual and one in-person knowledge exchange by X date. So that's specifically naming the group, the stakeholder group, time-bound, actionable, and realistic. Then define the audience of the KM intervention. So this should be the same audience or a segmented version of those who responded to your needs assessment. And then you will select the KM tools and techniques to implement to meet your KM objectives, which I will go over in the next slide. This is the KM tools and techniques matrix. We use this to determine which KM tools and techniques might be appropriate for meeting stakeholders' needs and accomplishing objectives. So KM tools and techniques, as you can see here, can range from activities that focus on collecting knowledge and connecting people to that knowledge, to then pushing knowledge to key audiences and enabling other audiences to pull the content they need. So we think of this in two continuums. Connecting and collecting are at the top and the bottom of the matrix, and then pushing and pulling are on the sides, creating a matrix in which KM tools and techniques can be understood in terms of broad approaches they use in the KM cycle to generate, capture, and share knowledge. So asking approaches at the top are for eliciting tacit knowledge or the know-how in people's heads that sometimes you need to ask about in order to uncover. Telling approaches are for conveying knowledge to defined groups of people, so telling that knowledge. Publishing approaches are for sharing explicit knowledge, knowledge that is in a format that can be easily stored and shared with others. And then searching approaches allow people to pull the information they need when they need it. So taken together, these different approaches complement each other, and therefore we see effective KM strategies as those that often use multiple approaches. In an emergency context, it's essential to choose techniques that are appropriate for that context, making sure to meet the professionals where they are and are cognizant of the timing, as a technique that might be quicker to implement is probably going to be more realistic than a more robust technique that requires months to implement. I'll share a couple examples on the next slide. So for emergency settings, just to share one example of an approach under the connecting or asking section of the matrix is leveraging communities of practice to rapidly share and support adaptive management. This creates a platform for professionals working in the emergency response to ask questions of each other, share common challenges, and get advice for addressing these challenges. Important documents or guidelines can easily be shared in a COP platform as well. Due to the nature of an emergency, it's often more effective to leverage the existing communities of practice rather than to create a new one. And an example on the other side of the matrix, in the collecting or publishing quadrant, is to document and publish program experiences. In an emergency setting, case studies and how-to guides, for example, can be useful for quick summaries of successful implementation experiences and can often be produced quicker than a published journal article, for example, and therefore reach a wide audience quicker. These are just a couple examples, and I will not share too many because my colleagues' next presentations will go into more examples of KM tools and techniques that respond to different audience needs. So just the final key tasks in step 3 are to develop an implementation plan and budget, and the routine and rapid monitoring and evaluation, or M&E plan. Employing a rapid and routine methods to collect feedback and assess the impact of your KM innovations is essential to assure that you are meeting KM needs. This brings us to step 4, create and iterate. In this step, you'll identify your KM team, identify the KM skills required to implement the KM strategy, and select staff and leaders who can support them. Then develop the KM tools and techniques. Consider the sustainability of each KM activity from the design phase, including which components need to be sustained post-emergency and which do not. So take into consideration KM approaches that require maintenance or have associated costs, such as resource centers or websites, because you have to think about how will the information continue to be made available after the emergency so that it is used to inform future response efforts. And finally, test or gather feedback about the KM tools and techniques, revise and retest. Step 5, mobilize and monitor. This is when the KM lead implements the KM intervention, schedules routine team meetings to assess progress, and adapts as necessary. I won't go into too much detail here because you'll hear more in my colleagues' presentations. So finally, step 6, evaluate and evolve. For this step, the KM lead will decide which program outcomes to measure. The KM tools and techniques that you implement should help ensure that critical, high-quality information is available and accessible, that knowledge exchange and collaboration among implementing partners and public health professionals are brokered and supported, and that capacity is strengthened for knowledge sharing. Most KM interventions and emergencies focus on affecting initial outcomes and sometimes intermediate outcomes. So therefore, some illustrative M&E indicators for KM could be the number or percent of public health professionals that report knowledge gained, or the number or percent of professionals who feel confident they know where to go to access up-to-date, reliable information to inform their work. Remember to choose the evaluation design that makes sense for the context. Given the speed at which emergencies occur, an evaluation that's quicker to implement may be more prudent. Some examples of this could include online surveys, periodic polls, or reporting on web analytics. In this step, you'll want to, of course, share evaluation findings and lessons learned broadly with key stakeholders to promote their use in policy and practice. This helps to inform future emergencies, and we'll also hear more about this in the next presentations. So with that, I will pass it back to Anne, who will lead us for the next section. Thank you.
Thank you so much, Natalie, and thank you to everyone who's asking questions and chatting in the chat. We really appreciate it. We're compiling all of your questions and we'll be sure to address them at the end. You hopefully have seen that we've been adding some links to the chat as well, so you can find the roadmap and the materials at the links that were shared. Please add any additional questions in the chat as we continue. But before we move on to our next presentation, we wanted to hear from all of you through a quick Zoom poll. So we're going to launch a poll. You'll see the window pop up now, hopefully. If you could please respond to the question, how do you see yourself using the KM roadmap materials during a public health emergency? And there are several answer options, including training others on how to use knowledge management, implementing internal KM efforts, coordinating KM efforts among various partners, and designing KM response programs. And please select all that apply. I'll give you a minute to respond. All right, we still have a lot of answers coming in, so I'll give you a few more seconds. Okay, I think we can maybe pause the poll and show the results. What I'm seeing here is the majority, 74%, will be using the roadmap to implement internal KM efforts, which is exciting to hear. 69% will be using it to coordinate KM efforts among various partners, which is also wonderful. 63% to train others on how to use knowledge management. We'd love to hear if you do use our materials to help train others, so please let us know. And then 40% to design KM response programs, which is exactly what we want to hear. So wonderful. Thank you all for those insights. Okay, well, next, we're going to hear from Yvonne Wangale, and who will share a case study on how the Knowledge Success Project integrated knowledge management into the USAID COVID-19 response efforts. Before she begins, I wanted to provide a little background. Knowledge Success began working on the COVID-19 response late in 2022, so not from the beginning of the response efforts. Our goals were to document the current COVID-19 vaccine landscape and disseminate those findings, curate resources and synthesize knowledge related to the COVID-19 vaccine response and related programming, and support knowledge exchange among COVID-19 vaccine implementing partners, and finally, to publish COVID-19 vaccine lessons learned and programmatic adaptations. And it's actually under this scope of work that we created the Knowledge Management Roadmap for Public Health Emergencies. Yvonne has been working with Knowledge Success to support this scope of work, and she's going to provide an overview of how Knowledge Success integrated KM tools and techniques into the USAID COVID-19 response. So Yvonne, over to you. Yvonne, I don't hear you. I don't know if it's just me. Okay, I hear from others that we can't hear you, Yvonne. Oh, I believe you're back. Can you say something?
Hello.
Hello, we hear you.
Okay.
Go ahead,
Sorry
please.
about that.
Thank you.
Thank you. Thank you. So I will be taking you through the application of knowledge management to the COVID-19 pandemic and providing some examples that we engaged in. So you can move to the next slide. Okay. So the COVID-19 pandemic, as we are aware, presented significant challenges for health systems worldwide as they struggle to allocate limited resources to both online programs and pandemic-related needs. So managing the response was a complex undertaking, requiring knowledge sharing, coordination, and continuous learning among stakeholders. And USAID's Global Health Bureau awarded Knowledge Success to provide technical assistance to the COVID-19 vaccine response in the form of knowledge management, synthesis, and sharing. So I'm going to take us through a few knowledge management tools and techniques that are available. So there are a number of these tools and techniques that have been applied during the COVID-19 pandemic, and some of you may be aware of some of them. So some of these knowledge management tools and techniques that Knowledge Success has implemented to support the COVID-19 response include the learning circles, essential resource collections, webinar series, the lessons learned documentation, blog series, Sharefare, journal supplement, case studies, and stakeholder analysis. Because of time, I will only focus on 3 of these specific tools that I've been involved in, and these are the highlighted ones: learning circles, lessons learned documentation, and case studies. So we're going to start off with the learning circles. I know that some of you who are here at this webinar had requested more information on knowledge exchange events. And the learning circles is a good example. It's been conducted both physically and online as well. And when you think of a learning circle, think about a small group huddle. So people huddling around an issue to brainstorm, to share successes, challenges, and solutions. So learning circle supports
Sorry,
participants
Yvonne.
with different experiences, learn from each other, and exchange knowledge. Small groups that guide program managers. About, can you hear me now? Apologies for that. I think I have a
You
problem
were
with my
cutting in and
internet
out.
connection. Okay.
You were cutting in and out. I'm not sure if it's better.
Let me try and just turn off my video.
Okay.
Okay. Let me turn. Hear me now?
I think so.
Okay. Apologies for that. I'm hoping my internet will be stable. But as I was sharing, the learning circles, when you think about a learning circle, think about a group huddle, huddling around an issue, brainstorming, sharing success, challenges, and creating solutions, and supporting each other from different regions and countries. So they are highly interactive, small groups that guide program managers and technical advisors working in public health through supportive discussions into what works and what doesn't in program implementation. Normally, learning circles are typically conducted in 4 sessions to improve their programs. And I've had the privilege of facilitating 1 physical learning circle and 1 online learning circle as well, and witnessed this collaboration coming through. I'm going to get into why learning circles. So find that learning circles are an effective way for knowledge management. Knowledge Success has held 2 physical learning circles, one for Anglophone countries and the other for Francophone countries as part of the COVID response. And the insights from both groups is available on the Knowledge Success COVID-19 resource page, which I think has already been shared on the chat. The objective of these learning circles is to increase practical knowledge regarding the COVID-19 vaccine programs, to strengthen partnerships among participants, made up of both implementing partners and USAID missions, and then finally also create practical and realistic action plans to address participants' unique challenges. So these are the main objectives of the learning circles as part of the COVID-19 vaccine response. In terms of the sessions, these are more or less the 4 sessions that participants go through. First off is to getting to know one another, where participants introduce themselves because they come from different organizations, countries, and regions. And then in the second session, they work on what's working well. And this is where participants identify program strategies and approaches that have been successful. And they use different techniques such as appreciative inquiry and one for all. When we talk about appreciative inquiry, it offers a way of thinking that reframes question. So normally we'd start thinking about an issue with what is wrong, but with appreciative inquiry, we start focusing on what's right, what is actually working. We also focus on how we can do more of what's working. It also moves from problem solving to solution finding, and it's an asset-based approach, looking at what you have rather than what you don't have. So it's an effective knowledge management technique used within the learning circles. And the guide to the appreciative inquiry or the approach is a technique called the one for all. And as the name suggests, this is how it is being done. It starts with silent reflection, self-reflection by participants, and then participants share and develop ideas in fours. And then finally, participants come back to plenary and share one idea that stood out in that conversation. So that's session 2. Session 3 is what could be improved. So now that we know what's working well, what you have available, we now look at what could be improved. And here participants identify program setbacks, challenges, and consult with each other about how to address these challenges to move forward towards solutions. And they do this using a knowledge management technique known as Troika consulting. And it is an approach that can help people better understand their problems they face and unleash local wisdom to solve them in quick consultations. So participants have opportunities to ask for help and get immediate advice from 2 other people. And peer-to-peer coaching helps to discover solutions in everyday life, reveal patterns, and refine prototypes. So the final session, after we've learned what is working, what could be improved, we now move on to taking stock and action planning. And here we use the technique known as a cover story activity, where participants take learnings on top success factors and key challenges into consideration as they identify lessons learned. And this activity is meant to be aspirational. It asks participants to consider at the start of the program implementation to replicate the successes and avoid past mistakes. And participants then come up with specific actions they can each take, known as commitment statements, that either helps them to solve a specific problem they're facing or amplify what is already working as well in that context. So this is an overview of what the learning circles participants go through. This is an image of one of the sessions held physically in Tanzania. And we have 34 participants from 17 sub-Saharan African countries. And this group continues to engage even after the learning circles through the WhatsApp group, which is very active till this day. In terms of more information on the learning circles, I've seen a few chats on the same. I think there is a link that has been shared on the same. It can be also found on the link on the next slide. Erin, please move to the next slide. Yes, the link right here, which will also be shared in the chat. On this link, you can also find a how-to guide, training slide deck, and templates. And the resources are available in French, Portuguese, Swahili, and English. I now want to move to a different knowledge management technique. And this is the lessons learned documentation, which involves reviewing available documentation on COVID-19 approaches, conducting in-depth interviews or focus group discussions with key stakeholders with a focus on learning from their experiences and recommendations for better response for the COVID-19 pandemic. And the qualitative data is then thematically analyzed. The results are presented to participants for consensus building and additional input before a report with practical insights are published. The lessons and effective practices are disseminated to the public in a practical document that could be quickly and succinctly reviewed to inform the design and implementation of future emergency responses. And the outputs of these activities support COVID-19 vaccine implementing partners, host country governments, institutions to identify, document, and apply lessons learned to inform the current, the COVID-19 pandemic and any future emergencies as well. Why do we think it's important to use a documentation process for this? It presents effective practices that are disseminated to the public. It supports COVID-19 vaccine implementation, especially to partners, host country governments, institutions, to identify, document, and apply lessons learned, not only to the current emergency, but also to others as well in the future. So it's very important to do this. Finally, I want to talk about the case studies. So a case study is a knowledge management tool that provides a detailed account of a particular issue. It's an in-depth examination or investigation of a particular event or issue, and they provide insight on complex situations. They involve analyzing problems and providing solutions for problem solving. They present teaching and learning tools and involve gathering data from various sources, as well as allow for practical applications. On the COVID-19 pandemic, Knowledge Success developed 3 case studies, which are available on the website. COVID-19, one of which is COVID-19 vaccine coverage in Ethiopia, successes, challenges, and lessons learned, experiences and lessons learned from USAID support in Ethiopia, implementing a comprehensive vaccine misinformation management system, insights and implementation details from UNICEF North Macedonia, and finally, implementation strategies to accelerate community COVID-19 vaccination rates, experiences and lessons learned from USAID support in Côte d'Ivoire. All the case studies are available in English and French. I'll want to delve deeper just into one case study, which is the Ethiopia case study. And this looked into factors leading to successful and challenges to the COVID-19 vaccination in Ethiopia. Data was collected through desk review, interviews, and focus group discussions. And the objective of this particular case study was to document lessons learned from the COVID-19 vaccine response in Ethiopia, to provide valuable insights for future pandemic preparedness for Ethiopia and other countries, identify COVID-19 vaccine response successes, challenges, and lessons learned that can be integrated into future global response efforts. And again, I think the link has also been shared on the same. So please have a look at these resources in terms of case studies, documentation, and the learning circles. Thank you very much, Anne. I think I want to pass it on to you. Thank you.
Thank you, Yvonne. That was a great presentation, and your audio was great at the end. So there seems to be quite a lot of interest in the chat regarding the Learning Circles approach. We will definitely get to all of your questions during the discussion, but I also want to recommend that you check out the Learning Circles module on the KM training package. I believe that link was shared in the chat, and we can also share it there as well if it hasn't been shared already. So finally, I'll be sharing an example of how we integrated knowledge management to support the USAID funded Zika response under the previous Knowledge for Health or K for Health project. But before I do that, we'd like to launch another quick poll and hear from you. So you should see the poll question here. The question is, what KM tools have you used in an emergency setting or seen used? And there are many different responses. You can select as many as you'd like. After action reviews, peer assists, share fairs or similar like learning circles, written documentation efforts, webinars, resource hubs, or other. I'll give you all a moment to respond. Right, the responses are coming in. It looks like a lot of people, over 90%, have used or seen written documentation efforts used. And I think that makes a lot of sense. That includes case studies, blogs, peer-reviewed journals, etc. And that is incredibly important during an emergency response. Also, 61% webinars. We're all on a webinar right now, so that makes sense as well. And webinars are a really effective approach to reach a broad audience with updated information during an emergency. Resource hubs are also an effective approach, which I'll be talking about in my slide. And after action reviews, I'm happy to hear that we also have a KM training package module on that as well, including peer assists and share fairs. So these are all wonderful KM tools and techniques that can be used within an emergency and outside of an emergency as well. All right, so if we can move to the next slide. So as I mentioned, I'm going to share an example from the USAID-funded Knowledge for Health project. Knowledge for Health was a knowledge management project for family planning and reproductive health professionals based out of Johns Hopkins Center for Communication Programs that ended in 2019. And during my time on the K for Health project, I managed our knowledge management activities for the USAID Zika response. And as I'm sure you'll all remember, the Zika virus was declared a public health emergency by the World Health Organization in 2016, and USAID provided emergency support to 10 different countries in Latin America and the Caribbean. So through this case study, I'm going to walk through several examples of how we use the 6 steps in the roadmap to integrate KM into the Zika response. However, although I'll be describing and presenting the 6 steps as though they are a linear approach, I think we all know that implementation of KM during a public health emergency response is often cyclical more than it is linear. So for example, as an emergency progresses, you'll need to do needs assessment of public health professionals responding to that emergency. Therefore, the needs assessments should be conducted throughout, not just once at the beginning. And each needs assessment could lead to the implementation of new KM tools and techniques that would then take you back through the steps of the KM roadmap. So if you'll remember from Natalie's presentation, step 1 is the enabling environment, which includes allocating and awarding funds to knowledge management. And that's exactly what happened here. So the Knowledge for Health project was awarded funds by USAID to serve as the KM lead for USAID-funded implementing partners working to mitigate the negative health effects of the Zika epidemic. And the primary objective was to connect implementing partners with one another, with USAID, and to essential resources. So K for Health kicked off this work by conducting several different needs assessments. We did this through online surveys and discussions at various partner meetings and communities of practice among public health professionals responding to the emergency. And the majority of the technical working groups or communities of practice that we were a part of and that we spoke to for the needs assessment were already existing communities of practice prior to the Zika emergency, but they had shifted their focus to Zika during the emergency. From the results of the needs assessment, we developed 3 specific objectives for our work, which you can see here. The first was to promote knowledge sharing among partners, document and share lessons learned, and adapt, translate, and ensure access to timely resources for the Zika response. And we use this information and these objectives to create a KM strategy around these objectives. So our KM strategy included multiple KM tools and techniques that were implemented at different points in time throughout the Zika response. And I'm not going to touch on every KM tool and technique we implemented, but I will share a few with you today. And our strategy also included consistently assessing the needs of those responding to the Zika outbreak because we knew their needs were changing as the response shifted and evolved. So when we get to step 4, create and iterate, one of the first activities that we implemented was to create the Zika Communication Network, which I'll refer to as the ZCN. This was meant to ensure that responders had access to timely resources. So the ZCN was an online repository or hub that curated hundreds of essential evidence-based tools and resources. And the resources available on the ZCN were from a variety of partners, and they were meant to help those responding to Zika minimize the spread of Zika and the related negative pregnancy outcomes. When we launched the website, we conducted in-person and remote usability testing to identify issues using the platform and ensure that we were meeting the needs of responders. Since the ZCN was consistently being updated with new resources from many different partners responding to Zika, and these resources were really timely to inform response efforts, we wanted to ensure that responders knew when a new resource was added. So our idea was to launch a social media presence for the ZCN that would promote each new resource that was added as it was added. However, before we launched the social media account, we conducted a survey and we found that implementing partners did not want to receive information via social media during an emergency response, and instead they preferred to receive information through an email newsletter. So we quickly pivoted away from social media and created a bilingual Spanish and English e-newsletter, and we shared events, tools, and resources through the e-newsletter. A while later in the response, about a year into the Zika response, it became apparent that implementing partners also needed an internal platform to share information with one another and with USAID. So K4Health created the ZCN Partners website. This was a password-protected platform for open communication between USAID's Zika team and USAID-funded implementing partners. So partners used the partner site to submit monthly reports, to document current and past research activities, submit M&E data, and access agendas and meeting notes, as well as non-public resources and materials. K4Health also facilitated the Zika Communication Network Advisory Group phone calls. The calls were originally envisioned as a way to vet the various resources that were being added to the external hub, the ZCN, to ensure that they included the most recent information and that they were in line with current best practices at the time. However, as needs changed and based on feedback from the implementing partners involved in the response, the advisory group calls morphed into an opportunity for implementing partners to inform one another of their project updates, of current studies and results, of upcoming events and new resources. So instead of gathering to vet different resources, we used the phone calls for implementing partners to take turns presenting on their work and having honest discussions about what was working well and what wasn't, so that all IPs were using the latest information to inform their programs. And I wanted to highlight this example of the Zika Communication Network and switching from social media to the newsletter, and the purpose of the Zika Communication Network advisory phone calls shifting to show how knowledge management can be nimble and quickly shifted based on needs during an emergency response. In addition, thank you. In addition to many other KM activities, we also hosted 2 in-person multi-day share fairs or knowledge exchange events to build trust among implementing partners, USAID, and other government representatives responding to Zika. The first share fair was implemented mid-response and focused on strategies for community engagement, and the second share fair was implemented near the end of the response and brought stakeholders together to come to consensus on overarching lessons learned that could be used to inform future public health emergencies like COVID-19, for example. The event brought together over 150 implementing partners, donors, and government representatives to discuss these pressing topics. And finally, we used the insights from the second share fair, where we discussed these overarching lessons learned, to publish Learning from Zika, a synthesis of lessons learned for future public health emergencies. So we chose to include this example from the K4Health Zika response in today's webinar and also in the KM roadmap itself to show how K4Health systematically and strategically used KM tools and techniques to quickly adapt activities to the emerging and ever-changing needs of implementing partners in an emergency response. So I hope you found that example useful of how KM has been integrated into public health emergencies. And if you'd like more information specifically about the Zika response, you can find it in the roadmap itself. So we have now come to our time for discussion. I see that we've been receiving more questions in the chat. I understand if some of you have to drop off, please know that we will be sharing the slides and the recording via email afterwards. But now I will open it up for questions. So please continue to add your questions in the chat. And I think we can go ahead and get started with some of the questions that we've already received. The first question is from Erin, and that was, how can you ensure there's funding allocated for knowledge management? Oftentimes donors and managers don't prioritize knowledge management. Maybe I can kick off a response, and then Alexia, I'll hand it over to you. We do address this in the roadmap under step 1, which is enabling environment. Our recommendation is to make sure that this roadmap is shared very broadly with donors responsible for coordinating emergency response efforts. We also recommend pointing to the impact of previous KM efforts during an emergency response, such as Ebola, Zika, or COVID, in terms of documenting lessons learned, bringing implementing partners together and sharing research findings. And then finally, in the roadmap itself, we include mention of using the SMART advocacy approach to advocate for the use of knowledge management in global health efforts broadly and also in an emergency response. And also, we link to a peer-reviewed article on the importance or the impact of knowledge management. Alexia, I'll hand it over to you.
Yeah, thanks, Anne, and thanks for the question, Erin. So, I mean, I guess just to add, I would say maybe that we have some examples of imperfect models that we should use and learn from next time. From USAID's side, during the COVID response, maybe about a year and a half in, like one example, USAID supported partners in creating we called it the COVID Vaccine Implementing Partners Forum, which brought together partners to share and crowdsource information. And we have many other examples in the midst of the pandemic that I think really served us well in allowing real-time best practices and discussions and lessons learned. And then just, I mean, as I mentioned at the top of the webinar, I think from USAID's side, knowledge management is becoming more formalized, and within the Global Health Bureau, which is where I sit, I think we're seeing the value of knowledge management more and more. So I hope that we continue to see it integrated and into programs, but it would certainly be great or better even if KM is specifically funded, but I think when that's not possible, there are still ways to ensure that knowledge and learning is captured, curated, and shared. Thanks. Thank
you, Alexia. The next question was from Yori, and I attempted to answer the first part of the question in the chat. The question was, is knowledge management also applicable for non-emergency situations such as HIV and NCDs? The short answer is yes, we recommend knowledge management be integrated into all global health programs. And then I also shared a link to the Building Better Programs Guide, which served as the foundation for the KM Roadmap for Public Health Emergencies. And it talks about a 6-step process for how to integrate knowledge management into global health programs. And Yori responded back with a question of if there were specific differences. And I'll just quickly state that yes, while the Building Better Programs Guide served as the foundation in the Public Health Emergencies Roadmap, we really tried to focus on how to do things quickly and efficiently and effectively during an emergency, because things are rapidly changing and the needs are so urgent. So I hope that answers your question, Yori. I don't know if any of the other panelists would like to respond.
Maybe if I can just add, to me, the difference between implementing KM during a non-emergency and emergency is the speed at which it needs to be done. So in a non-emergency, right, we can implement knowledge management tools and techniques and sort of, in a sense, like take our time, like set things up, have foundational knowledge management as a part of programming. Whereas in an emergency, you need to move faster. In my mind, I think if knowledge management practices are already set up during non-emergency times, it actually makes it easier than during when an emergency happens. But if that's not the case, you can still, as long as we have the ability to be flexible and adapt, we can still roll out knowledge management in emergency times as well.
Thank you, Alexia. All right, I think for this next question, oh yeah, please go ahead.
If I can just add, Anne, because the first part of your question was about applying knowledge management to other health areas, and Lillian put in the chat, she asked, can knowledge management approaches be used in PHED, which is Population Health, Environment, and Development programs? So I just wanted to share, I put this in the chat, that yes, absolutely. Actually, the Knowledge Success Project is, we were funded for this COVID response effort, but in general, we are a knowledge management project working with family planning and reproductive health professionals. And you can learn more about this at our website. I shared a link to People Planet Connection, which is a learning and collaborative space for professionals in PHED specifically. So you can check out lots of resources at that link that I shared. But just to say that, yes, KM can be applied to all health areas and should be.
Thank you, Natalie. All right, this next question is about learning circles, and I'll hand it to you, Yvonne. So Yori asked, are the 4 sessions for learning circles taking place on the same day? And how long is each one? And what's the limit to the number of participants?
Thank you. Can you hear me now? Oh, perfect. Thank
Yes.
you for the question. So the sessions do not take place on, they don't happen on the same day. I think they're spread across. For the online version, I think it's over 3 days. And I mean, for the physical version, it's on the 3 days. But for the online learning circles, we do it over 4 weeks. So 1 session a week, because it's a lot of content and a lot of learning that takes place. So it does not happen on just 1 day. In terms of the numbers, I know that we try and keep it a smaller number, not too large because of the work that needs to be done in smaller groups. So we normally would have about 30 to 40 participants, but Anne, you can correct me on that as well. Would that normally be the number, 30 to 40? So not too large a group, otherwise we will not be able to meet our objectives. Thank you.
And John, I think, had a follow-up question as well that Natalie, maybe you could respond to. How to identify participants for learning circles? What characteristics are most important? And are there guides to support effective facilitation in the roadmap itself?
Yes, thank you for the question. I'll respond to the last part of the question first because yes, we actually do have a training module on the KM training package specifically on learning circles and how to implement your own learning circles. So I shared a link earlier in the chat with a link to that training module. It is available in English, French, Portuguese, and Swahili, which we had funding to do as part of this COVID response funding. But yeah, just a little bit more about how we identify participants. Generally, it's open to professionals in the specific health area that the learning circles is focused on. So for this COVID-19 vaccination workshop, we identified COVID-19 vaccination implementing partners funded by USAID. So we worked with USAID to collect a list of the organizations working in the response and identify participants that way. And this was a little more unique because we had this specific targeted funding and we had the funding to do it in person. But typically Knowledge Success conducts these learning circles workshops virtually. And since we are a family planning project, we focus on family planning professionals. And the only characteristics that are important is that you be a professional, directly working in that space, and you be willing to come and be very, participatory. The learning circles workshops really demand active participation of participants. You won't get much out of it if you choose, to be less engaged or involved in discussions. It's really about sharing and learning from your peers. So those are the main requirements generally.
Thank you, Natalie. And I recommend you look at the Knowledge Management Training Package module on learning circles. I see another question from John. Do you have any guidance on conducting rapid iterative needs assessment? Are there techniques to make this effort efficient to balance the need for action while continuously learning and evolving emergencies? I can quickly provide a response, but I'll hand it over to others as well. I think what we've done in the past to ensure that things are done quickly during an emergency response is a lot of online surveys, but also a lot of asking people at existing communities of practice or technical working groups, attending a lot of meetings, and also noting down any challenges that are mentioned in those meetings, and then asking responders, am I hearing this correctly? Is this an actual challenge? Make sure that it's resonating with people. And I would also recommend that you look at the template. We have a needs assessment template in the KM roadmap as a template. So I would recommend that as well. Any other panelists like to add to that?
I think that was a great response, Anne, and I would just add as well that on the CAM training package, there's also a module on assess needs specifically. This was part, this is a step in the original roadmap from which we adapted this roadmap for emergencies. So we have this existing assess needs training module, which goes very in depth, and I'll share that link in the chat.
And maybe just one more addition to what's already been said is just to ensure that there's dedicated staff time to do these efforts. Sometimes we say we want to do all the things, but don't assign responsibility. So it's important that we just have one or more people or a team that's committed to doing these types of activities.
Thank you. So we also have another question here from Khadija. Does the KM roadmap include recommendations on knowledge management tools and techniques to implement in acute versus protracted crises? I think the short answer to that is not called out in the roadmap itself. However, we'd be more than happy to have a discussion with you about that and brainstorm how different tools and techniques could be used to address timelines of different emergencies. Does anyone else have anything additional to add to that? I think when looking at the KM matrix, there are some approaches that would likely work better for an acute emergency response versus a protracted one. And hopefully you can glean that type of information from the roadmap itself. Any additional thoughts on that? All right. Any additional questions? I think we were able to get through all of them. Well, we have 2 minutes left, so I might move on to close us out. And Lillian, I see your message here. I'll write you, and we'd be happy to reach out to you and work with you. Okay, so you can definitely access the knowledge management roadmap for public health emergencies, including the video, slide deck, and templates in French, English, Portuguese, and Swahili on the KM training package website, which we've mentioned, or by scanning the QR code on your screen. And if you're interested in knowledge management and global health more broadly, you can also find many other valuable training resources on the KM training package website. So with that, I want to say thank you to Alexia, Natalie, and Yvonne for your presentations today. Thank you all for your questions and the rich discussion. We hope that you all found the KM roadmap for public health emergencies useful for your work. And if you end up using the knowledge management roadmap, we would certainly love to hear from you. You can see my email here on the slide. If you have any questions for any of the presenters, please reach out to me and I'll put you in touch with the appropriate person. We will share the recording and the slides after the call today. And thank you all again for joining. Thank you to our presenters, and I hope that you all have a wonderful rest of your day. Thank you.
Thank you.
Thank you.